Many problems with hair loss begin with the scalp. And for that, a trichologist may be your best stop before visiting a local drugstore. When it comes to hair loss, Dr. Alan Bauman, founder and medical director of the Bauman Medical Group, is one of the leaders in hair loss and transplant surgery. Dr. Bauman has been featured nationally on the Today Show, Good Morning America, Fox News, CNN, and the medical syndicated program, The Doctors. He joins us on Hair Loss Solutions TV to offer his insight on trichology.
Hey, thanks so much for having me, Jeff.
It's really great to have you here. I know your schedule is absolutely jam-packed. You were just in Italy traveling over to the CR labs that were over there.
Correct.
You must have enjoyed the food, I'm sure.
Oh, the food was amazing. I mean, I was there for 5 days. I came back with 1,000 photos, and half of them were food.
That's typically good. That's good. That's my Italian heritage. So
yeah, for sure. It was amazing. It was amazing.
The most important thing that we're here for, hair thinning and hair loss and the scalp conditions that come along. In another segment, we're going to talk about the surgical part of it, but let's talk about trichology. Tell us about hair losses and hair loss causes. Give the audience that are out there the knowledge that A, they're not alone, and the reality that there are solutions. Tell us about trichology that we've been hearing about all through the news.
Sure. So many people have never even been to a trichologist, don't even know what trichology is. And especially here in this part of the world, in America, we don't have too many trichologists, people who are trained in the study of hair and scalp. But across the world, especially in Europe and Italy and such, of course I was there, and even in South America, trichologists are all over the place. And so if you've got a hair thinning problem, or if you've got irritation of the scalp or flaky dandruff or some other issue, you're going to go see it. You would think to go to see a trichologist first, but not here in America. But we're going to start to change that.
That's right.
Here in the U.S., if you've got a hair problem, many people would just jump over to a dermatologist, or maybe they would seek out somebody like me, a board-certified hair restoration physician. But there's no paramedical subspecialty, at least not yet. But we're changing that.
That's good. That's good. Well, let's tell the audience, Dr. Bauman, what is trichology? They hear that word, and that word really, like you said, has not been in America very long. But the reality is, what is it the study of?
Right. So trichology is the study of hair and scalp. So it's the study of hair and scalp diseases or problems. And many people think, well, that hair loss is the main problem that could go on the scalp. But actually, there's a lot more stuff that can happen. And I see it in my own practice. Even we know that, for example, the most popular shampoo in the world is Head and Shoulders. And it's why? Why is that? It's because a huge number of people, millions, maybe tens of millions or hundreds of millions of people have at some point in their time itchy, flaky, or irritated scalp. And we know today that science has proven in many, many scientific journal articles on this, that if you have irritated or inflamed scalp, you're not going to grow good hair. So these things, this trichology is uniquely intertwined with the treatment of hair loss and dermatology. And we're taught at a very young age, for example, how to take care of our skin and how to protect it. And as we get older, how to anti-age it. But no one's really spent the time to tell us how to take care of our scalp. And I think that's the role of a trichologist, to try to assess these problems, evaluate them scientifically, and then to come up with some kind of a program, whether it's, to decrease the oil production that's causing dandruff, or, to work hand in glove with a physician who can treat the hair loss problem.
That's really good. One of the things that the audience continues to ask us on our blogs and the different venues that we speak at is, can anything be done for hair loss and hair thinning? What have you been working on behind the scenes? Because I know you've got a number of things. You've just opened up an incredible trichology department from the CR Labs out of Bologna, Italy, and in conjunction with the University of Bologna. Tell us more about what you're doing in that department and how it's affecting all over the country with people like ourselves that are really getting more advanced and bringing that to America.
So what I've put inside Bauman Medical Group, and we're located in Boca Raton, Florida. I have an 11,000 square foot facility. You visited, obviously, and you saw that inside the clinic, we now have what I call Salon B. And Salon B, it has a full-time cosmetologist and trichologist who is there to help us manage these scalp issues. So when I see a patient in the clinic who has a hair loss problem and they also complain about dry, itchy, flaky scalp or oily, greasy hair or frizzy flyaway, whatever it might be, the question or concern that maybe goes beyond just a hair loss problem, then I can bring in the trichologist and we can do a complete evaluation. We can look at things like scalp pH. We can look at moisture levels, sebum levels. We can look with using a microscope with a blue light camera to see the microorganisms, colonies and such, to see whether we've got thinning density or decreasing hair quality or caliber. Look at the inflammation. And then develop a program, a treatment plan. So in conjunction with maybe a hair loss treatment plan, we can create a program that would identify and then treat either the excessive sebum production or something that we need to do to moisturize the scalp. And that might be just take-home products that the client goes home with, or maybe in-office treatments. So it depends on the severity and the condition, actually, how aggressive we would treat it, and whether we would do it in the office or at home. And then, of course, whether, and what the follow-ups would be and how long of a time it would go on.
Now, when a client goes through the treatment series, Dr. Bauman, you brought in the training program that I know attended with you in Boca Raton at your medical center, you have brought another dimension, which is not only that the CR labs have brought together the instruments to be able to examine a lot of the things you described, but once they're using the treatment, to be able to measure the calibrization of that hair follicle individually, you've really done something with the HairCheck. Explain, because so often, whether it's one product over the counter or another, they claim, or at 2 o'clock in the morning, they claim that it grows hair. Everybody buys it because they're in dire desire of having the solution.
Sure.
And they use it for a month or two, and there's no change, and suddenly, they're on to another product, and discouragement overwhelms them incredibly, psychologically as well as emotionally.
No, and that's about the HairCheck. Yeah, it's been a big problem for many, many years. I mean, here we are, board-certified hair restoration physicians, and we're prescribing treatments and procedures and so forth, anything from medications to oral medications, topical medications, laser light devices or nutritionals or hair care products. And what are they actually doing at the level of the scalp to improve your hair growth? Because a hair loss patient may experience hair loss for many, many years and try and spend literally thousands of dollars before they seek medical care or medical evaluation on products that simply don't work. But how do we as physicians kind of quantify and measure what's going on with our patient's hair? And the HairCheck tool is the way that we do that. The HairCheck tool is an incredibly simple device to use. It takes us 5 minutes to perform the measurements, and it gives us such a valuable piece of information. It actually measures a cross-sectional bundle. So imagine like taking someone's ponytail and just being able to measure the thickness of that ponytail, in a split second. Well, doing that at a microsurgical level or microscopic level in different locations on the scalp in an accurate way that we can repeat over time, we can tell whatever regimen it is, if it's something I prescribed, like a topical treatment or PRP treatment, whatever it might be, or whether you're going home and doing some kind of yoga pose upside down, I'm going to be able to tell you in 90 days how much new hair you've grown, which percentage of improvement you've had, which areas it's working, and which areas it's not. And, for many years, I think as physicians, we just kind of did a guesstimation from across the room. Yeah, it looks like you're doing okay. Or, yeah, the photo seems a little bit better. But, you have to change 50% of the hair mass in order for the photo to look different, bad or worse. So that's a lot of leeway in there, and that's not so good. So the HairCheck tool, which we teach and train physicians and cosmetologists and medical estheticians, paramedical people how to use, is a critical step for managing the hair loss process. We've done over 40,000 measurements, I'm proud to say. 40,000 hair checks.
Well, you also give a lot of confidence to the person who needs the time to grow that hair, that their investment of money is not going down the tubes. And at the same time, the result is there for them to see. In 90 days, that's nothing, and that passes so quickly. But you give them not only the computer readouts and the generated calibration of that, but it's an ongoing basis. Many problems with hair loss begin with the scalp. And for that, a trichologist may be your best stop before visiting a local drugstore. When it comes to hair loss, Dr. Alan Bauman, founder and medical director of the Bauman Medical Group, is one of the leaders in hair loss and transplant surgery.